Let me
Yeah,
interrupt you for a second, just for the
please.
interest of time. We have a few minutes left because one thing is there's a very important component called the Breslow thickness.
Hmm.
Can you tell us, like, I mean, it's from the top of the skin to measuring the deepest melanoma cells. How do you measure that?
Yeah,
Can
it's a
you,
great
for
question.
this particular example, where is the deepest melanoma cells and how do you measure it? Maybe you can walk us through that.
Yeah, let's see here. So in this case, yes, and that's what we do on every invasive melanoma. I measure a Breslow thickness. So you may see on your pathology report melanoma and a whole bunch of different little lines that talk about host response or regression or all these things. Of all of those things, the most important one in trying to predict how a melanoma might behave is the Breslow thickness. People have tried to figure out other ways over time, but so far the Breslow thickness seems to be the best thing that we have overall. Maybe that will change in the future, but for a long time now, Breslow thickness is the most important way that we can predict if a melanoma is more likely to be aggressive or not. And so for the Breslow thickness, what we do under the microscope, I actually have this little part right here. It's called the ocular. I have a separate one that has a little tiny measuring stick inside of it that shows me how big 1 millimeter is. And so I swap that out and look at the slide under the microscope. I don't have one here to show you, but I will tell you what we do is we start at the very top part, not the top of the flaky dead layer, but the part here where these purple little granules, we call this the granular layer of the epidermis. So I start at the top of the granular layer and I go down to the deepest invasive cell. So let's, for the sake here, there may have been one little deeper area here, but I'll show you this cell because this one's big and really atypical and it's easy to see. So that's what I do is I line up the top of my measuring stick here and I go down and I see how far down this cell is. So this melanoma, I looked it up, actually was a 0.8 millimeters in thickness from the top of the granular layer to the deepest invasive point. So the Breslow system, what it divides things into a T stage, and there's
Sure.
T1, T2, T3, and T4, right? And then sometimes we have an A and a B on those. So in this case, 0.8 would make this a T1B. And the T1 means it's less than 1 millimeter. And then it becomes a T1B if it's either 0.8 to 1 millimeters, or if it has an ulcer over the top. I don't have any ulcer to show you, but in this case, it was 0.8, so it was a T1B. And that's the area where the dermatologists and the surgeons start talking about, should we or should we not do a sentinel lymph node biopsy to see if the tumor has spread? Because once melanomas get beyond 0.8, they start having a higher risk of maybe spreading to lymph nodes. So then there's a discussion about whether that's the appropriate next step or not. And that's a pretty complicated topic, but I don't know if you want to delve into sentinel nodes or not here.
No, I think we got some other folks covering it.